Hello, and today's session is around eating, drinking, and swallowing awareness, giving you a bit more information about how to support a service user to have safe and enjoyable meals, snacks, and drinks. This is presented by myself, Caroline, and Sarah. We are both speech and language therapists in the Durham Community Integrated Adult Learning Disability team. So, the plan for today's session is looking at what is dysphagia, how dysphagia can impact someone with learning disabilities, how we chew and swallow, what can go wrong and why, how can we help manage risk, and we'll also look at an eating, drinking, and swallowing plan. So when we first think about what is dysphagia, we've broken the word down into two parts. So we are looking at dys, which means difficulty with, and phagia, which is chewing and swallowing. So dysphagia can be defined as a disorder of swallowing which can occur at any point during the passage of the bolus through the oral, pharyngeal, and esophageal structures. And we'll look at those different phases in a bit more depth later on. Here are some facts just regarding learning disabilities and dysphagia. So about 15% of people with learning disabilities require support to eat and drink, and around 8% of people known to a learning disability service have dysphagia. Individuals with learning disabilities are more at risk of choking than the general population. Aspiration pneumonia has been identified as a significant cause of death in people with learning disabilities. Other health problems related to dysphagia include malnutrition and dehydration, which can lead to hospital admissions. We'll have a look now at the normal swallow. So this happens in 4 stages, and we have the oral preparatorial phase, the oral phase, the pharyngeal phase, and the esophageal phase. And we'll go into a little bit more depth around these phases. So when we look at the pre-oral phase, this is when we are using our senses to see and smell the food that is being made. It'll help to produce saliva in our mouth, and that means that we're ready to eat. So at this point, we'll be feeling hungry or very thirsty. The next stage is the oral stage. So this is the second stage of the swallow. And at this stage, we will use cutlery or our hands to bring the food to our mouth. You will then open your jaw and put the food in your mouth. Once you close your jaw, your lips will seal together, and that will stop anything falling out of your mouth. Then you will use your teeth and lots of different muscles in your face, tongue, and mouth to break down the food and control the bolus. The saliva in your mouth will help to break down the food and provide moisture so that it's ready to be swallowed. This is all a voluntary movement, meaning that you can spit out any of the food if it's needed. The third stage of the swallow is the pharyngeal. So once the food is ready to be swallowed, the tongue will push the food up to the top of your mouth and back towards the pharynx, also known as your throat. You can see in the diagram on the bottom right-hand side some of the names I'll be talking about there, and that just shows you where that is within your mouth and within your throat. The soft palate will close, and that seals off the nose, which will help to make sure the food moves down to the pharynx. Now the food has reached the back of the tongue, which will then help to trigger a swallow. Breathing will pause at this time. The hyoid bone and larynx move up and forward, while the vocal folds and epiglottis close, and the esophagus muscles relax and open. The final stage is the esophageal stage. So this is when food moves down the esophagus towards the stomach. This will happen due to gravity and muscle contractions called peristalsis. Once the food has reached the stomach, the esophagus closes and breathing begins again. So we now have a video coming up, and that just shows you what the normal swallow looks like and also what a dysphagic swallow looks like.
So now we're looking at the oral stage. You can see that the chewing is going on, moving around the mouth by the tongue. It's now moving towards the back of the tongue and preparing to swallow. Now entering the laryngeal stage of the swallow, down into the esophageal stage. And you can see that's a really smooth action in a normal swallow. So looking at what we might consider a dysphagic swallow, see there's maybe not as much chewing in the oral stage, and it transfers to the laryngeal stage where you can see there's a problem there, and it possibly enters the airway instead of going straight down into the esophagus. Just going to show you that again. And there you can see the food entering the airway instead of going down into the esophagus where it should go. Okay, so when considering a dysphagic swallow, I'm now going to look at some of the things, some of the risks or things that we may see. The first being pain and discomfort whilst eating and drinking. So, for instance, in the oral stage of the swallow, a person may be experiencing toothache. Then we could see increased choking incidents and choking or airway obstruction, which can lead to death. We may see aspiration, increased number of chest infections or pneumonia. We may see a person who is at risk of dehydration and poor nutrition. And as a result of that, we may see weight loss. We may also see a loss of mealtime enjoyment and social engagement opportunities, and this can all lead to a reduced quality of life. And one of the bigger risks of having dysphagia is aspiration. And looking at this a little bit more in depth, the definition of aspiration is when food or drink enters the airway or trachea below the level of the vocal folds. In other words, the food or drink has gone down the wrong way. And with that, we might see signs of eye watering, lots of coughing, a change in colour. However, we must note also that that doesn't always happen. So as speech and language therapists, we need to be aware of silent aspiration. And silent aspiration is when aspiration occurs without the acute signs. So for instance, there may be no coughing or eye watering. So it'd be really difficult to spot. However, we also need to look at signs such as increased chest infections. And this is a sure sign that somebody is aspirating, even if they do have silent aspiration. The other biggest risks that we see in dysphagia is the risk of choking. And by choking, we mean that someone's airway becomes suddenly, partially, or fully blocked so that they can't breathe or breathe properly. And signs and symptoms that somebody is choking will be that they cannot breathe or breathe properly because that airway is fully blocked. So therefore, the person wouldn't be able to cough because they can't get the air in or out of the lungs, and they certainly wouldn't be able to talk. And with partial choking or mild airway obstruction, we should not give back slaps if the patient is coughing, and do not offer food or drink until the coughing has subsided and normal breathing has resumed. So just because somebody is able to get some air in or out, it doesn't mean that we should offer them food or drink to help clear. We need to make sure that that airway is clear. So next we're going to look at, why does somebody develop dysphagia, or why do things go wrong with a person's swallow? And it's important to remember that problems can occur at any stage of the swallow or at a combination of different stages of the swallow. And there may be different factors that contribute to this. So, for instance, physical factors might include a person's alertness or their levels of fatigue. Positioning or vision are also really important, because if a person isn't in an appropriate position, it would impede their swallow or their ability to swallow. We may have psychological factors. So, for instance, somebody may have experienced pain or discomfort previously, and therefore they then become apprehensive at swallowing foods. And this can contribute to them having eating, drinking, and swallowing difficulties. And environmental factors include things like, has the person got appropriate utensils to use? Are they in an appropriate position or in a quiet and calm environment? And we need to remember that quite often people with learning disabilities need minimal distractions in the environment. So it's important that they have a quiet and calm environment to eat and drink in. Now we're going to look at some possible speech and language interventions for people who have dysphagia. So we may have sensory modifications that we look at. We also make sure that we actively promote oral hygiene as an intervention. We may look at modifying a person's diet or foods to ensure that they're easier to chew and swallow. And we may implement more functional approaches such as personal placemats, and these would help to ensure that everybody is following and aware of the eating and drinking recommendations that have been put in place. So looking at sensory preferences when we're looking at interventions for people with learning disabilities, we need to be aware that sensory changes are commonly a commonly presented feature, sorry. So for instance, some people may suddenly prefer sweeter tastes when they previously preferred savoury tastes. So therefore we might look at saying to people, make sure that you're offering sweeter foods and this aligns with their likes and preferences. A person might be temperature sensitive, and this can often relate to people holding food in their mouths for longer. So for instance, if a temperature is like just warm, maybe they cannot feel that it's in their mouth. So we would look at ensuring that they could feel it by maybe lowering the temperature rather than making it too hot to eat. We would look at colder temperatures so that the person could actually feel what was in their mouth. But we also need to consider as well that if we do change a person's food, then we need to be aware of the impact that appearance of the food can have on the person. It may make them think, oh, I'm not eating that, for instance. We also need to look at, is the person able to still recognise what food they're eating? So if somebody goes from normal food to a level 5 minced and moist, for instance, then they may not recognise what they're eating and therefore refuse to eat it. And this can be a major problem for people who have more advanced cognitive deficits, for instance, dementia. So another intervention that we consider is oral hygiene. And this is something that we actively do as speech and language therapists, because the promotion of oral hygiene and a person making sure that their mouths and their teeth are clean. And this will impact directly on a person's chest health, which is obviously really important. So, for instance, we would advocate that the person carries out mouth care twice daily, or they're supported to carry out mouth care twice daily. We often advocate the use of fluoridated toothpastes. We advocate that people clean the teeth, gums, and if possible, the tongue to help rid the mouth of bacteria. And in that, we also have to consider sugar-free medications sometimes to help prevent decaying teeth. And we would be aware of the impact of supplements on teeth, because many of our clients do have supplements on a regular basis. And we would advocate that our patients see a dentist for regular dental checkups, preferably at least every 6 months. Looking at personal placemats, for instance, so this is an example of one of our placemats, and these can be laminated and given to the home or given to the person so that their family carers or professional carers can refer to it when needed. You know, for instance, if there's new starters, then everybody can be assured that they are following guidelines, which is really important. And finally, looking at texture modification. So we can modify a person's diet to make it, for instance, easier to chew and manage for the person with dysphagia. However, when we're looking at modifying a person's food and drink, then we also need to balance a patient's safety with patient's choice. So, for instance, some of the things that we think about in regards to patient safety is making sure that they're able to meet their nutritional and hydration needs, and also ensuring that we are protecting the airway as much as possible. Against this, we have to balance patient choice. So, for instance, what does the patient like? Are they likely to eat a modified diet? And what are their preferences? We also need to look at the person's quality of life, because eating and drinking is a major part of enjoyment for many of our patients. So, you know, by limiting what they can eat, this could have a direct impact on their quality of life. And we also need to look at what is least restrictive to the patient.
So when we're thinking about texture modification, we use the ED&S framework. So this was implemented in 2019, and it's replaced what was used to be followed. So ED&S stands for International Dysphagia Diet Standardization Initiative, and these provide a description of the types and textures of food and fluids that individuals need to be on who have dysphagia and who are at risk of choking or aspiration. So the framework provides a standard terminology to be used by all professionals and food providers, and it just makes sure that everyone is following the same guidelines. So I'll go into a little bit more detail on each of the levels, but you can see that the two triangles, the top one looking at your foods and the bottom one looking at drinks. And so, yeah, we'll have a look through them together, and you can get a little bit more information about that. So this was just what I was referring to just before, saying that they used to be called dysphagia diet national descriptors, and that's what was used to be followed. However, now we're looking at the ED&S framework, so you can see that comparison there, and the changes to some of the names, just to make it a little bit more clear on what is expected at each of the levels. So when we think about people with dysphagia, there may be some foods and textures that might be harder for them to swallow. So a speech and language therapist will advise whether these foods should be adapted, avoided, or an alternative should be offered, depending on the individual and depending what level they are on with the IDSIs. So these are the textures we need to kind of consider. So stringy, fibrous textures. So for example, pineapple or celery. Vegetables and fruit skins, we might think about grapes. Mixed consistencies would be cereal with milk. Crunchy foods, crisps or dry toast. Crumbly items such as biscuits. Hard foods such as boiled sweets or nuts. And lastly, husks such as sweet corn. When we have a look at first level, we've got IDSI level 7A. So this is your regular food, but easy to chew. So the foods should be cooked to a soft and tender texture. Any method can be used to eat these foods. So you can use your fingers, cutlery, chopsticks, and there's no size limit for these foods. So they can be cut into any range of sizes. You should be able to bite off pieces of the soft and tender food, and you should be required to chew the food. And so it's making sure that they are chewed enough to be safe to swallow without them becoming tired. Within this level, it can include mixed thin and thick textures, unless otherwise advised by your speech and language therapist. So that would include your cereal with milk. Food should be able to be cut or broken apart with the side of a fork or spoon. A knife is not required to cut this food. This is a little video just to give you a little bit more detail.
In this video, I will be demonstrating the correct step-by-step testing methods for level 7 easy to chew. The emphasis here is on softness and tenderness. There is no restriction on the size of the pieces, but all foods in this category should only need a small amount of chewing. Foods should be well cooked but moist. So if you squash them with a spoon or a fork, they should squash down and not spring back to their original shape. You can apply quite a bit of pressure. Any foods that are not well cooked enough or al dente would not pass this test and would require longer cooking. You should also be able to break the foods up using the side of the fork or spoon. So at this level, you won't need a knife. Everything needs to be soft. So the meat, the vegetables and any accompanying pasta, potato or rice all need to pass these tests. So the food must pass all of the tests before being served. To achieve a really tender result, try poaching, steaming or casseroles. A thick sauce can be added for additional moisture. Avoid roasted foods or anything that is dry, crispy or crunchy.
And the next level we're going to look at is IDSI level 6, which is soft and bite-sized. So food is soft, tender and moist, but does still require some level of chewing. The food should be able to be broken down easily with the pressure from a fork, and it must be soft, tender, but no separate thin liquid coming from the food. It should be bite-sized pieces, no bigger than 15 millimeters, which is the size of an average thumbnail or the size between the prongs of a fork on either the kind of last sides of the prongs. And it can be served with a thick, smooth sauce, such as gravy, custard, or cream, so just making sure that it is the right consistency. If there's any meat, it must be cooked until tender, and ensuring that there's no hard pieces or crusts when the food is being presented. And those high-risk texture considerations that we talked about earlier, we would need to be speaking with a speech and language therapist to know whether we are avoiding them or adapting those foods. Again, we have another video just to provide a little bit more information around that.
In this video, I will be demonstrating the correct
Oops, I'll play that one again, sorry.
In this video, I will be demonstrating the correct step-by-step testing methods for level 6 soft and bite-sized food. The emphasis at this level is on softness and size restriction. At this level, there is no need to bite, but you still need to chew. Pieces should be no larger than 15mm by 15mm. You can check this in two ways. It's the size of an average adult thumbnail, and it's the distance between the outside prongs of a fork. The size restriction applies to all solid foods at this level. Foods should be well cooked but moist. If you squash them with a spoon or a fork, they should squash down and not spring back to their original shape. You can apply quite a bit of pressure. Any foods that are not well cooked enough or al dente would not pass this test and would require longer cooking. You should also be able to break the foods up using the side of the fork or spoon. So at this level you don't need a knife. Everything needs to be soft, so the meat, the vegetables and any accompanying pasta, potato or rice all need to pass these tests. So the food must pass all of the tests before being served. To achieve a really tender result, try poaching, steaming or casseroles. A thick sauce can be added for additional moisture, but avoid any thin sauces. Avoid roasted foods or anything that is dry, crispy or crunchy. If you like dysphagia.
The next level we're going to look at is minced and moist, and this is level 5. The food must be soft, tender and moist and can be eaten with a fork or spoon. It can be scooped or shaped, and small lumps are visible within the food, but making sure that the lumps are no bigger than 4mm in size. The lumps should be easily squashed with the tongue, and ensure that the food has been mashed or minced before serving it. If there is any meat, making sure that it's finely minced. And if there's any fluid on the food, so such as gravy or custard, it's making sure that it's very thick. There shouldn't be any mixed textures within this level, so your example of cereal and milk would not be allowed. So there can't be any loose fluid. Ensure that there's no hard pieces, crust or skin that has formed during the cooking, heating or standing of the food. And ensure that fluids in or on the food have not thinned out or separated. And again, we just have another video to give a little bit more information.
In this video, I will be demonstrating the correct step-by-step testing methods for level 5 minced and moist. The emphasis at this level is on softness and size restriction. At this level, there is limited chewing involved, as you can use your tongue to break down the tender food. Pieces should be no larger than 4mm by 4mm. This is easy to measure because it's the distance between two prongs of a fork. It's possible for one side to be up to 15mm in length, equivalent to the distance between the outside two prongs of a fork. This would allow for a piece of well-cooked orzo pasta or rice. The size restriction applies to all solid foods at this level. Foods should be extremely well cooked but moist. If you mash them with a fork, they should easily squash down and separate through the prongs of the fork. Your thumbnail shouldn't turn white when running this test, so very little pressure is needed. Any foods that are not well cooked enough or al dente would not pass this test and would need more cooking. The food should also sit in a mound on the fork and not drop through the prongs. Food at level 5 should also be able to hold its shape on the spoon. When we tilt the spoon, however, it will slide off to show us it's not too sticky. There should be very little left on the spoon. So the food must pass all of the tests before being served. Finely mashed or chopped, very tender minced turkey or chicken or fish could be good options here. Gravy or sauce should be nice and thick. Finely milled rolled porridge oats, well cooked with lots of milk or cream, could be appropriate. These are just ideas. In all instances, the ITSE tests must be run to ensure the dish complies. If you liked this video,
The next level we're looking at is pureed and extremely thick, and this is ITSE level 4. So these foods are usually eaten with a spoon. They do not require any chewing, and they have a smooth texture and there's no lumps. They must be able to hold its shape on a spoon, and it will fall off the spoon in a single. If it's been tilted, it should be able to fall off. Making sure that this food isn't sticky. It's important that pure foods are not too sticky because this can cause the foods to stick to the cheeks, teeth, roof of the mouth, or in the throat. Again, we've got another video just to give a bit more information.
correct step-by-step testing methods for level 4 pureed food. The emphasis at this level is on smoothness and the correct thickness. There should definitely be no lumps. You can bulk puree up with calories using full cream milk, cream, avocado, sweet potato, ground nuts. Try not to puree with just water to avoid losing nutritional value. Concentrate on how it looks. You can layer, pipe, mould, as well as nice strong flavours. Food at this level will need to be eaten with a spoon without having to bite or chew. For this test, spoon the mixture onto the fork. The puree should sit in a mound on the fork, hold its shape and not drip through. Also, if you draw your fork across the top of the puree, the fork should leave its mark. Food at level 4 should hold its shape on a spoon. When you tilt the spoon, however, it will slide off to show it's not too sticky. There should be very little left on the spoon. So the food must pass all the tests before being served. If you like this video,
And also want to talk about transitional foods. And these are foods that start as one texture but change into another texture when moisture, such as water or saliva, has been added, or if there's a change in temperature. So for instance, if the food has been heated up. Biting is not required and minimal chewing is only needed. Tongue pressure can be used to break these foods once the texture has been changed by either the moisture or the temperature. So there's some examples on the screen here of the types of transitional foods. And to test if the transitional food, you would use a bite size, 1.5 centimeters amount of the food, and add 1 milliliter of water to the food and wait for a minute. And once this is softened, you can test using the fork pressure test, which has been mentioned before when we were looking at soft and bite size.
Okay, so now we're going to talk a little bit about thickening drinks for our patients with dysphagia. So thickening drinks is certainly something that speech and language therapists have done to help people swallow fluids more easily. And it certainly has had or can have positive impacts on the person's ability to swallow and enjoy their drink. However, our attitudes to thickening drinks have changed over recent times due to more research being done and the evidence that has been found from that research. So some of the more positive things that can come out of us thickening a person's fluids can include the fact that it can make drinking fluids more comfortable for some people, and it can make it less tiring and less worrying for people. However, we need to just take into consideration that using thickener does not necessarily stop aspiration if a person is aspirating on their drinks. And it's not always the best option to choose because of this. So looking at some of the risks of using thickener, first one is that it can make chest infections worse and longer lasting. So if somebody is aspirating on their fluids, then if we add thickener to that person's drinks and they aspirate on it, then they are more at risk of developing chest infections, and those chest infections can be worse than if they don't have thickener. So thickener can also can stop certain medications from working. They can upset a person's stomach. And another risk of using thickener is that people can experience having more urine infections. And other risks include the fact that some people may not like the texture of thickened fluids, and therefore they don't drink as much as they should do. And this can lead to a risk over hydrational needs, and that people can become dehydrated, and this of course can have a really negative impact on their health. So this slide just actually reminds us to think before we thicken, and you can have a look at these documents on the slide just to clear any questions that you may have, and give you some more information on why we may not always choose to use thickeners with our patients. And another thing that we just want to touch on today is to reiterate how important it is that people make sure that they follow a person's eating and drinking plan. Because by not following a person's eating and drinking plan, it's the same as not giving someone their medication that's been prescribed by a doctor. And some of the risks that we see by not following a plan include health risks. So a person would become more at risk of choking or having chest infections. They may incur weight loss that they wouldn't do if their eating and drinking plans were being followed. Of course, if we're not following eating and drinking plans, then there's a bigger risk of fatalities being seen. And we also need to recognise that if a person is not following an eating and drinking plan like they should, then they are at risk of safeguarding and legal proceedings being taken against them, especially if somebody suffers from choking or becoming ill because their eating and drinking plan isn't being followed. And just looking at a person's consent to eating and drinking plan. So sometimes we may give somebody an eating and drinking plan. However, they may not want to follow it. So, for instance, a speech and language therapist can review if a risk has changed and look at a least restrictive option for eating and drinking whilst ensuring safety and risk management. If risk still remains, but the service users are not following their eating and drinking plans, we can review the service users' understanding of risks and offer education to support this. However, we cannot advise that eating and drinking at risk when living in supported living or in a care home, as it is the carer's legal responsibility to manage risk and ensure safety of the service users. So, you know, we must give recommendations that adhere to what we have actually assessed. And if a person is at risk of eating and drinking, then we must ensure that we produce the. So this slide just gives information about where you can find further information on eating and drinking. And you can see the ED&S website, which is really helpful and easy to follow. There's also a link to the Royal College of Speech and Language Therapists, and there's some further guidance on the bottom of the slides there. Slide is just giving you details on how you can get in touch with us at the Speech and Language team at Durham. There's the team email, which is the duty email, and this, for instance, this would be where all referrals were sent to. You can also send queries to this, especially if it's probably the best way to contact us, just in case of annual leave or sickness, and you can guarantee that somebody will pick up your query or your referral by using that email. And we just want to make sure that please do not hesitate to contact the Learning Disability team or care coordinator to discuss any concerns about a person's eating and drinking, and these can be passed on to us within the team. Thank you for listening today, and we hope you enjoyed our presentation.